around the beginning of 2014, you saw all the great success we had in 2013 with over doubling our business the start of 2014. And we have not only done that, but surpassed that for 2014. And it has been an absolute incredible year for Healthiest too, and we contribute that to all of you as our partners, and we thank you for that. You know, we've not only doubled our business, we've also doubled the number of brokers. So you are spreading the word, getting the information out there that Healthiest You is really changing the healthcare system by redirecting claims through our utilization and through the tools that we've provided for you. And we're going to continue to improve and increase those come 2015. I know many of you are aware of our app that's coming out very shortly, but you know, we're going to continue to update our websites, make that process so much easier, not only on a partner side, but on the member side. We know how important it is as far as the experience, and we appreciate your feedback and your continued support in Healthiest You, and we could not have done this without you. Over the last few months, we've been monitoring the business through our brokers and how well they've been doing. And I'm not sure if anybody out there, if you are aware, but come the end of January, here in Scottsdale, Arizona, Scottsdale, Arizona, we have a huge golf event. It's the Phoenix Open, which I'm sure a lot of you are aware of. But we have invited 15 of our top producers. They will be joining us January 28th and 29th on the 16th hole. And it's an experience like no other, and we're excited to be bringing in these brokers for this event. But with that being said, we will be having an event on January 29th that evening for all brokers that are in town. We know in the insurance industry that a lot of people do come out for this event, so we want to extend the invitation out there to you as a broker that if you are in town, we will be having an event at the local bar here. It's called the Arena Sports Bar and Grill, which is located right next to the location of the Phoenix Open, the TPC. So like I mentioned, I would love for you to join us if you're in town. We will be sending out an invitation in the next week or so. So please let us know if you will be here and if you'll be able to attend. But with that being said, I would like to pass the controls over to Eric Kronengold, and he will be going through the product presentation. Eric?
Thanks, Angel. Thanks for taking the time to join on this call, everybody. We hope you had a very successful 2014, and like Angel mentioned, we could not have done what we do without you. It's very important for all of you to know on this call that we do not go direct to clients. It's a very conscious decision we made years ago when we started this. We didn't want any kind of channel conflict, so we didn't want to compete with you for the clients that are yours and have to worry about that portion of it. So everything that we do is because of our brokers and our partners around the country, so we thank you very much for that. With that being said, we really look forward to 2015. Angel mentioned on the call that we have a lot of success and a lot of growth. There's a number of reasons for that. One is obviously all of you on this call and your counterparts across the country really embracing telehealth, embracing Healthiest You, and making it a vital part of what you do in terms of rounding out your overall benefit plan design. We've really become aggressive on pricing. Our pricing was dropped drastically about 90 days ago, and it looks like we're going to keep that moving forward. I'll have Angel touch on that towards the end of the call. But the real main part of it is just the overall acceptance of telehealth. It's no longer a novelty. It's no longer, well, that kind of sounds like a neat benefit. It's becoming a vital part of benefit plan designs with engaging members and with redirecting claims. And that's what we do at Healthiest You. So I'm going to go over a little bit of a product overview. Then I'm also going to talk about how Healthiest You is different, how we really view the overall benefit plan design, and how we can really make a difference for your clients moving forward, either new clients or existing clients moving forward for 2015. So Healthiest You itself is the marquee part of what we do is telehealth, and that's getting in touch with a doctor when you need to. So the statistics are the Wellness Council of America, the AMA, estimate that over 70% of all times we go in to see a doctor, whether it's urgent care, emergency room, or primary care doctor's visits, over 70% of those calls can be handled safely and effectively over the telephone. And that's where we come in. And that's the marquee part of what we do. So 24/7 access to a licensed doctor. You call up our physician network 24 hours a day. A licensed doctor will call you back. We guarantee a 1 hour callback time. Our average response time right now, when a doctor actually calls a member back, believe it or not, is only 9 minutes. It's amazing, and trust me, those times are not embellished. I used the service a couple times over the holidays. The doctor actually called me back in 1 minute. It was crazy. I was calling on behalf of my children, and they called back and got everything resolved that quickly. So that's what we do. But in 93% of the cases, that doctor will actually diagnose over the telephone, and if necessary, they'll phone in a prescription to any pharmacy you like. That's the phenomenal part of what we do, and the overall need of what we do. But just telehealth alone, and I'll touch on this kind of throughout the presentation, just having that service by itself is worthless if nobody uses it and nobody knows about it and you don't encourage utilization. And that's where we are experts. That's where we come in, and we don't view ourselves as just a telehealth company. Healthiest, we view ourselves as a member engagement company and a claims redirection company. And we are very good at it, and we'll make you look good in front of your clients, and we'll get them using the service and loving it, but actually making an impact on that claim. Part of the way we do it is not only through the telehealth, we also get them involved with our personalized online wellness program. We like to say it's the only online wellness program that gets smarter with use. The more you use it, the more it learns how you are motivated and interacts with you. And I'll touch on how that program works in a second. And then we also get the member engaged with our prescription drug pricing tool, and I'll share that with you. Now remember, all these services this is not a la carte. This is all included in our one low monthly membership fee that we're just getting those members engaged and getting them to use Healthiest You. So the physician access. This is 24/7 access to licensed doctors. They're all located in the United States. They're all board certified physicians. It's available by phone, video consultation, or email. It's available in 48 states currently. Doctors we can't have doctor access in Idaho or Arkansas. It's an industry issue. We're trying to get those resolved as quickly as possible. And one of the things that we do have is by far the largest physician network in the industry. Most of our competitors have anywhere from about 200 to 500 doctors on their network nationwide. We have almost 2,400 doctors. That's because we give them a lot of utilization. We give them a lot of calls. So we have to have a large physician network. Now you're going to get a few main questions that come up, and these are very, very similar questions time and time again by clients. Number one, is this legal? Yes, it's legal. In the United States, we work under what's called cross-consultation laws. We've been doing this now for over 7 years, and it's approved in all the states except for Idaho and Arkansas, like I mentioned. The other question you'll get is, okay, who are these doctors? Are they doctors on a call center overseas? Are they fresh out of medical school? And the answer is actually the opposite. These are very highly credentialed physicians. They average about 14 years experience, and we have all types of doctors on our network. We have a lot of primary care doctors. We also have a lot of emergency room doctors on our network because they're used to seeing so many different types of conditions. And then we also have a lot of specialists like pediatricians on the network as well too. And then one of the biggest questions you're going to get is, well, what can a doctor really handle over the telephone other than just sore throats and that type of condition? And if you look at the top 9 reasons, this is from the AMA of why we actually go in to see doctors in person. Those top 9 conditions are allergies, bronchitis, earache, sore throat, pink eye, sinusitis, strep throat, upper respiratory infections, and urinary tract infections. These conditions almost are identical to the types of conditions that our physicians treat over the telephone on a daily basis. So if you look at the top 9 conditions why people go in to see a doctor are almost identical to the top 9 conditions that our doctors are treating over the phone, you can see how you can get to that 70% number rather quickly. And this is just a small list of the types of conditions that we treat. The list goes on and on. There's hundreds of different types of conditions that we can treat safely and effectively over the telephone. So one of the things that we are very, very passionate about at Healthiest You is the member experience. We know that as a broker, as a consultant, working in with your clients, that you're putting your trust in us, that the service that your Healthiest is providing is going to be effective. It's going to be a great experience. They're going to get their issue resolved, and we're going to be done in a professional and courteous manner. So when we partner with you and go into your clients, whether they're existing clients or new clients, we want to make sure that that overall member experience is top notch. We want to make sure they get their issue resolved quickly, but we want to make sure that they have such a pleasant experience that they come back and use it again. They're going to recommend it to their families. They're going to recommend it to their friends, to their coworkers, and they're going to go to their employer and they're going to say, that's a great service. Keep it. I love it, and don't lose that service. And we have a very, very high retention, over 90% retention in our groups with our members, because they love the service and they want to keep using it. So I'm going to walk you through what a sample call looks like. So the first time you'll schedule an appointment, the member will call up. The triage specialist will have an intake call. So the first time they'll provide their medical history. So kind of imagine yourself going into a doctor for the first time and you're filling out your name, age, height, weight, drug allergies, past surgeries. All that's done, and if it's done, once you do it, it's stored in your HIPAA compliant portal. You can access that anytime. You don't have to do it again. That's for the employees, for their spouse, or for their dependents. They'll all have their own HIPAA compliant portal. So the triage specialist will then determine why you're calling, what the condition is, and then what type of doctor. They'll schedule that call with the appropriate doctor. The doctor will review that patient's history prior to calling the member back. If a prescription needs to be sent in, they'll send it via e-script to any pharmacy you like. So this can be we don't care where it goes to. You tell them if it's a pharmacy by your house, it's by the work. If you're traveling, maybe in a different state, they'll do a Google map search and find the most convenient pharmacy to send it over. The doctor will update notes in the consultation, and then that member actually receives a follow-up survey, because we want to rank our doctors. We want to make sure they had a great experience, and we also want to ask them, what would you have done? Would you have gone to emergency room? Would you have gone to urgent care? Would you have gone to primary care? And then we share those results back with the employer to show what kind of impact we're having on the overall claims. So that's the telehealth and the member experience. Now, leg two of the stool of our service, if you will, is our online wellness platform. And this is not a little off-the-shelf afterthought wellness platform. This is a world-class wellness platform that we actually acquired coming up on over 2 years now from Dr. Kelly Travers. She's a world-renowned physician and wellness expert. Dr. Travers is a Stanford-educated physician. She was a former global medical director at Google worldwide, and she took a team of neuroscientists that studied 10,000 patients over an 8-year period, and they came up with a system that actually gets smarter with use. So as you use it, it actually learns how you're motivated, makes recommendations of how you learn and what will actually get you to accomplish your goals in wellness. So you can concentrate on 8 different areas. You can concentrate on weight, nutrition, physical activity, stress, mood, sleep, smoking cessation, and blood pressure. And when you first log on to our system, you're going to pick a virtual coach. That coach will help you through the program to help you reach the goals you're trying to achieve. You'll then fill out a brief health risk assessment. It takes about under 5 minutes, but it'll kind of zero in on what you're trying to accomplish. And then this is where the system takes over. And it's very, very cool, because it actually, everybody in the world is going to be, their experience is going to be a little bit different than everybody else, because the system's so dynamic. So you can program the system you can just log on the web. You can log on via an iPhone app. You can program the system to email you when you'd like. You can program it to text you. I've been using the system now for over 3 years, and I concentrate on exercise. So I program the system to text me every morning and ask, did you exercise? And it asks, did you exercise? If yes, how many minutes, at what intensity? And I text back, and the system keeps track of that and makes recommendations. The system has over 200 short videos that are under 4 minutes that Dr. Traver personally did that will get you to concentrate on the area that you're trying to reach in your wellness. There's points that are involved, so you can either play a game and try to reach different levels, just compete with yourself, or employer groups can actually set up and reward their employees based on the points that their employees reward. You can share with social media to your friends, family, coworkers to participate with you to help you reach your goals. You can track your progress in the activity log. And then there's a personal library that stores everything that you've done in the system. So all the videos you watch, all the recipes you've downloaded, articles you've read, are all stored right there for you to access quickly. Like I mentioned, you can just access online. You can get on the mobile app via iPhone, or there's actually a book that's called The Healthiest You that a lot of our members read to help them reach their goals and really maximize the program. Now, the third leg of what we do, if you will, remember, it's all included in the same price, is our prescription drug price comparison tool. You can save up to 85% on medications. This actually beats copays 7 out of 10 times, especially with today, and I'm sure you've all seen this with really high deductibles, high copays in prescriptions. This is working very, very well. And the cool thing about it is not only do your employees and the members save money, but you're actually keeping these claims out of the plan as well too. So I'm going to jump out and show you how the system works real quick because it's pretty cool. So this is our member portal here. So you can go here to speak with the doctor now. You can get into your wellness, or you can get into the discount prescription. So if I did a pharmacy lookup, the system will pull up this. You put in the type of drug you want. So I'm just going to type in Lipitor. We're in Scottsdale, Arizona here, so we're in 85255. So watch when I click this button how fast it works. Boom, it's going. This will shop every PBM, every pharmacy, every grocery store, every coupon that's available out there in the area. So in the 85255, this is North Scottsdale, pulled up all the pharmacies that this Lipitor is available. So I shopped Lipitor, 30 tablets, 20 milligrams, and it automatically reverts to generic. So if you look at the lowest priced here, Walmart's $13.10. Fry's is a local grocery store, $13.35. But look at the pricing here. So if somebody walked into Fry's, for example, to buy this prescription with cash, it would be $150. With our system, it's only $13.35. If this is the one they want, they click on Get the Coupon. It'll pull it up. They can print it. They can email it to themselves, or they can text it to themselves. It gives them all the information that the pharmacist knows. It gives all to give that discount out there. But you can look at the disparity now. Look, if I scroll down here and you look at Walgreens or CVS, $154, $141. This goes back to what we do and what we're good at. We educate that employee. We want them to be good consumers. We want them to not just take what the pharmacist gives them, shop and look around and find the best price. Take charge of your wellness. Take charge of how you're going to treat your body and take care of your overall wellness. When are you going to talk to a physician? How are you going to, if you're sick and you call up and a doctor says, I can't meet with you for 2 weeks, are you going to take that, or are you going to take charge of when you're going to talk to a physician on your own terms? And that's through our service. So that's really what we're all about in terms of member engagement and really changing the face of how people interact with doctors and how they interact with their own health. So if you look at what we do, one of the big things that we really, really stress to our brokers is that we want you to take a look at the way benefit plan designs are built. So start with Healthiest You. We highly recommend you. The majority of our groups are employer paid, so the employer's paying for all this for all their employees that are on the medical plan, or for all their employees, period. So if you start with Healthiest You, and we can handle up to 70% of the times they're going to see a doctor, we give them 0 consultation fees, we give them the wellness, we give them the discount prescription. Now you build your benefit, the rest of the plan around it. So you take your major medical, and whether it's an HMO or a PPO, maybe you're raising copays or eliminating them altogether. Maybe you're limiting office visits, raising the deductible. Putting this into an HSA or a self-insured plan is a no-brainer. But the whole goal is that you're trying to save enough money on the major medical that you're not only freeing up enough money to pay for Healthiest You, but now you're also paying for some of the other supplemental products like GAP, critical care, accident, cancer. Maybe even coming in and putting some ancillary benefits in there, like dental, vision, chiropractic, or even life or disability. If you do this, our brokers that are engaging in this strategy, not only are they freeing up enough money to pay for Healthiest You, but some supplemental products, but they're also making more commission on this, and with little or no, or actually maybe even a reduction in their renewal rates, depending on what you can negotiate with the carriers. So our brokers that are doing this, the employer is extremely happy because they're getting they're actually maybe saving money on their medical plan moving forward when the plan's renewed. The employee's happy because they're actually they're not seeing it as a takeaway from the major med because you're giving them Healthiest You and some supplemental products. And you as a broker, we've seen brokers that are doubling their first year commission. So now you're not just taking and making money from the major med, you're also making commission from Healthiest You and making commission from some of the supplemental products. It's an amazing strategy, and it's going to make you look different to get into new groups, to protect yourselves from brokers employ the same strategy coming in and trying to take your existing groups. And it's just been a very successful overall plan for us to do that. Now, one of the things that we really, really stress is utilization. And we know for a fact that our largest competitors, their overall book of business, their utilization is under 2%. These are published. This is what they do, and this is kind of their strategy. They'll give you the telehealth service, and basically it's have a nice day. You're going to get a membership card, and that's it. Then because of that, it's under 2%. So if you look at that, what that means is, let's say you had a group of 100 employees, less than 2 of them a year would be using telehealth service with our competitors. We found that we wanted to make a change in the industry years ago when we started this, that this is such a powerful service that you need to have people use the service, and you want them to use it for a number of reasons, because you want to really impact the claims within that plan, and you want them to keep that service in place for a long time. And because of that, at Healthiest You, our overall utilization on our block of business these are 2013 numbers, is 39.75%, almost 40%. Now for 2014, when we get those final numbers, that number is actually going to be over 40%. And that's a major impact you can have on claims, and it's not by accident. It comes from a lot of work. It comes from the benefit plan design that I just showed you. It comes from the physician access, the zero consultation fees. We have the online wellness to keep them engaged. We have the prescription drug pricing tool, very member-friendly portal. But then it really comes from massive employee communication. We don't say, here's the service, have a nice day. We really get them engaged. We set up monthly marketing campaigns to emails. We're not trying to sell them something. We're trying to remind them. We give them emails that say, right, it's cold and flu season. Remember, you can call Healthiest You free of charge. Summertime, you're on the beach, you're traveling. Remember, you can call Healthiest You free of charge to speak with the doctor to handle your conditions. And because of that, we have very, very high utilization. Now, one of the things I'm going to touch on is we are very, very excited about a new app that's coming out. I know that every company you hear, the kind of the buzzword is an app, and now it's going to change everything. Well, at Healthiest You, we put our money where our mouth is. We spent a lot of money on this app, and it's from our partners from the carrier space and from the high-end consultant space that have seen the betas of this app. They see that it's going to be a game changer in terms of what it can actually handle. So it's going to be basically a one-point access for all of your healthcare needs. What I mean by that is everything that you could possibly do will be put into this app. So not only can you access Healthiest You, you can actually there'll be geofencing reminders in there. So for example, if somebody walks into an urgent care facility, we have thousands and thousands of urgent care facilities loaded into our app that are geofenced, so it'll actually pop up a benefit reminder, let them know, hey, it looks like you walked into an urgent care facility. Did you know that you can call Healthiest You free of charge and most likely get your issue resolved? And then a little countdown will start going and let them know how long they've been waiting to actually see an urgent care doctor. Same thing will happen for the prescription. If they walk into a pharmacy, it'll pop up and have them the benefit reminder that, hey, did you know you can shop for your prescriptions and maybe save a lot of money doing that? It'll also we'll feed them content. So now, instead of them having to proactively go on for their wellness, let's say they get an allergy medication prescribed, we'll feed them content now with videos on how to manage allergies and that type of thing. So it'll also get into, you can book doctor's appointments right online. We'll be connected right into real-time booking services with doctors, specialists, any kind of doctor that you're trying to get done. You can shop for procedures to actually find the price, a price comparison, so there's price transparency for procedures. You can actually submit for medical second opinion. So if you get a diagnosis and they recommend a particular procedure, you can scan those documents right onto your smartphone, email those or get those over to us for a second opinion, and we'll actually give you free of charge. It's all included in. You can get an actual medical second opinion. So some pretty amazing stuff. That app should be out, we would say, in the next 45 to 60 days going live, but it's something that will be an absolute game changer and really make you look good in front of your clients. One thing that I really want to talk about before we get into the pricing on this is this is an amazing plan that the kind of the theme and the overall strategy that we want you to think about for this call is trimming the fat. And what we mean by that is everyone makes New Year's resolutions. Everyone wants to lose weight or do some different goals for yourself. But we want you to really concentrate on trim the fat with your clients. What we mean by that is we want you to reduce claims. So we want you to reduce the claims that are unnecessary going on in their medical plan. We want you to take those claims with Healthiest You. We want you to get those on our side. The other thing that we want you to do, a couple different things. We want you to register on our partner portal. I'll get to that in a second, but we also want you to really think about all the different things that Healthiest You offers. So if you look at telehealth itself and you think of it as an apple, and our competitors have telehealth, it's an amazing product. It really is. And Healthiest You has the apple too, but not only do we have the apple, we have the entire fruit basket. So we have our custom wellness platform, we have custom marketing, we have a retention team that will actually jump in, work with that group administrator, get them to communicate with their employees and how they actually are going to be effective, making sure their employees know they have the service. We have co-branded enrollment sites. We have the discount prescription savings. We have admin portals, so your administrators can go right on, make adds, deletes, or look at their invoice and make changes right there on the fly. We have an engagement team that will get them using the service and remembering that they have the service. We monitor utilization. We track that very seriously. We have custom marketing. We have the game-changing app, like I mentioned, as well, too. Finally, and we do have an amazing partner portal. I'd really encourage every single one of you on this call to go afterwards. Go to hypartner.com. If you haven't registered already, register. It's free of charge. It's a custom portal that we do for our partners like yourselves. You can create proposals that are amazing with your name on there, with the employee's name, the employer's name, everything you need to know. There's a real-time, there's dashboards where you can get into creating your email campaigns, everything you could possibly need in terms of there's ROI calculators. There's plenty of custom marketing and materials in there for you. And one thing that we really want you to take advantage of is we found that our agents and agencies that have the Healthiest You service, that use it themselves, now you have something to talk about. You have a testimonial. So not only are you getting a great service for yourself, but you actually have a story to tell now. And because of that, we actually offer to, as an individual for an agency, we offer 30% off of our normal rate for you to get that for yourself or for your agency. So we really encourage you to do that and get that product for yourself or for all of your employees at your agency. Now, finally, we're going to get into pricing. I'm going to turn it back over to Angel. Thank you. Angel will wrap up the call, but we look forward to working with you in 2015, and we hope that you really consider Healthiest You on all of your clients moving forward, whether they're new or existing, and we can help you with all those proposals and help you get those groups on board with us. Angel, I'm going to turn it back over to you.
Thank you, Eric. All right, so I know we've received a lot of questions, emails, calls recently over the promotional pricing, because in those terms, it stated that the pricing would end the end of January. But the great news is that we are going to keep this pricing as is. But I do want to go through those terms a little bit further in detail with you, just to make sure everyone is aware on where this applies. So the prices that Eric has listed here, the $9 and so forth, this is for new groups only. So anything going forward, any new groups that you bring on with enrollment from now going further until further notice, this does not mean groups that have, they came in the beginning of 2014. And the reason why we keep it this way is because we see a increased utilization percentage the second year. So we want to definitely keep them at those rates where they best fit, but we do want to offer this promotional pricing going further. As most of you know, this is no consultation fees, so a member can call unlimited times for these rates with no additional cost. There's also voluntary rates, the individual at 11 and a family at 15. Those rates will remain the same as well. So great news going forward. Everybody has provided their feedback on this pricing. It has gone over very well, so we appreciate the time and effort that you put into this, marketing this. It has been successful for everyone. We cannot express, the gratitude that we have for you for taking this and running with it. But that said, we appreciate your time today. If anybody has any questions, please complete the questions tab, and we'll try to go through and answer some of these for you. So first question here I have is there anything for Spanish-speaking people? Yes. So we have a Spanish-speaking triage, so when a member would call to speak with a doctor, they will have the opportunity to speak with a customer care rep that will intake their information, and we do have Spanish-speaking physicians available in all states. That member would need to request a Spanish-speaking physician, and we will connect them with a Spanish-speaking doctor at their earliest convenience. Next question, will all activity conducted and information given over the phone be reported to the MIB? Eric, can you expand on this one?
Yes, it's a good thing and it's a bad thing. We actually keep it out of MIB because our product is not actually insurance, so we don't have to report to the medical boards. So that's a good thing because you actually keep those claims out. But what we do is the member has the ability to go into their own partner portal and put in their primary care doctor's email address. So we'll share our consultation notes with that primary care doc to keep that continuation of coverage going. But because it's not insurance, we actually keep that out of the claim and keep that off of any kind of medical records for Privacy Acts as well, too.
Thank you, Eric. Next question is, what information is released to the employer, i.e. the data generic without employee name? We do offer utilization reports on a quarterly basis for groups of 25 or more, and what we provide is a breakdown of how many calls. We would not provide the employee name or the reason for that specific call, but we will put in the top reasons of why people called. So this is available, a utilization report on a quarterly basis. We would send that out to the group administrator, and it would provide the number of calls for a certain period. Next question, what about Spanish on the wellness platform? Unfortunately, at this time, the wellness platform is not available in Spanish. Next question, does a person have to be a licensed health insurance agent? Your presumption is right here. You do not need to have a license to sell the product because Healthiest You is technically not health insurance. We are a broker direct model only, so we are not out there recruiting non-licensed individuals. Everything through our channel is coming through brokers. But for example, if it's an agent that's coming on that has not necessarily licensed yet, so in the interim wanted to go and sell Healthiest You, they are more than welcome to do so. Next question, define family for individual. Are gay partners in the same household covered? Yes, families up to, we have individuals, we consider family up to 6 individuals, but partners are definitely covered in the household. Does the pricing include a 15% commission to the producer agency? Yes, that is our contract level. So for the residual life of the membership, the broker will receive a 15% commission on those deals. It seems like the Healthiest You prescription comparison is free. It is if you go onto the website. The only information that you would be able to, the only way that you would be able to obtain the website is by our our fulfillment kits that are sent out, which will give them the instructions on how to access that. So it's not a published, member.healthiestyou.com is not published except on our fulfillment kits. But you can definitely go on there and price those prescriptions out at any time. Next question here, commissions. We discussed that. That's the 15% commission for the residual of the membership. Next question here, RX coverage is discount and not creditable. That is correct. This is a discounted benefit through our system where you'd be able to print that off and provide that to your pharmacy. For myself, there's some things that I have done in the past. I will take my insurance card and my prescription discount into the pharmacy and have them see where the best discount is provided. So, like we say, we can be copay 7 out of 10 times, but it doesn't hurt to try both. The title and the name of the doctor who wrote the book on Healthiest You, that's Dr. Kelly Traver. She is our Chief Medical Officer here for Healthiest You. Next question, is there a fee to the sponsor for the voluntary access? Eric, I'm not sure that question. Do you?
Yeah, I'm not sure what they're trying to get to there. I think maybe a little more clarification on employer paid versus voluntary. So employer paid is when you have the employer's actually, we're going to list bill that employer. You can build this straight in. So I'd say 90% of our clients, the employer is paying 100% of this. So we're just going to list bill them. They're going to pay for this for their employees. However, they can choose to have the employee pay for a portion of this, and that's up to the employer's discretion. So they may want to match what they're doing on the medical side and pay 65%, 50%, it doesn't matter. As long as we have necessary participation, so we need at least 75% participation of the employees that are on the group health plan. So you had a 100 life group, we need at least 75 on Healthiest You. If the employer says, I don't want to pay for any of this, but can you offer this on a voluntary basis, that's where these rates kick in. So 11 for an individual employee, 15 for an individual plus one. That's why those rates come in. And then you can actually offer this, if you sign up on the partner portal, you can actually offer these rates on an individual basis. So if I'm sure many of you on the phone do individual group plans, this is an amazing service to add right on. And if you register for the partner portal, once again, it's free to go on our partner portal, hypartner.com. You can actually have your own individual landing page where you can just send a link to employees. They can put in all their information, their credit card. They'll get an amazing kit. Let me show you what this kit looks like. We actually contract with the same company that does the American Express Black Card, so they'll get an amazing card with their name on it, instructions on how to access the doctors, how to access the wellness, and how to access the prescription savings as well too. So hopefully that answers the question.
Thank you, Eric. This kind of goes into the same type question here. For employer paid plans, does the plan only go to the employee or does it include the employee's family? If not, will the employee need to sign up independently? So yes, so those rates, the employer paid rates include the whole family. So if it's an individual, one person, or if it's up to 6 individuals, or I'm sorry, 6 people in the family, the rate remains the same between $2.99 employees, $9, and so forth. So that does cover the whole family. For my understanding, I cannot sell this in Arkansas. That is correct. Right now, Arkansas and Idaho are the only states where we are unable to offer the service at this time. And as soon as that changes, we will definitely make that information available to you. Let's see the next question here. Can any individual sign up and enroll, or does individuals have to be part of a group, meaning you don't have to offer this to open mass market? As Eric just mentioned, you have in your partner portal, you have your individual enrollment site, each broker when they enroll as a partner, where they can enroll individuals directly from there. And those rates are $11 for an individual and $15 for the family. Let's see here. If an employer wanted to pay 50% of fee, can price be negotiated or does it go to voluntary? As long as they're, like Eric mentioned, 75% participation, and the employer can contribute as little as they want or as much as they want. We would not have any say in that, but as long as there's 75% participation in that in that group, we will take the employer paid rates. The site to register as a partner, it's www.healthiestyou.com. In the top right-hand corner, there's a Partners tab. Once you select that Partners tab, they'll go through the registration process with you. It takes a couple seconds to complete, and then you'll have access to your contract, which will have the information regarding your commissions. And next question here. $15 per member in the family. It's not per member, it's for the whole family. So $15 includes the whole family per month. Can we recommend a doctor for the service which will help medical facility in my area? You can definitely recommend a physician. We can't guarantee that there's a position available in your area, but we would definitely be happy to take their information. I will get that information over to you after this call. Do you have a list of states that cannot accept over-the-phone prescriptions? The only states that we are unable to provide service that will not do the over-the-phone prescriptions are Arkansas and Idaho. I believe that's what that question is asking. If a group is in Oregon but they have an Idaho office, are the Idaho folks not covered? It's where you're calling from. So if you are calling from Oregon and that the office is in Idaho, the Oregon members would be covered with no problem. Even if the Idaho office, they're working working remotely in Oregon or whatever it may be, as long as you're calling from Oregon, you will have access. We do not have physicians available in Idaho or in Arkansas. When you take a call with one of our physicians, they need to be licensed in that state where you're calling from. Because if a prescription is needed, they'll need to be able to call a prescription into a pharmacy. So they're going to ask you that first when you're going in an intake call, is where are you at the time of that call in case the prescription is needed. How does a family of 7 or more price out? This is on a case-by-case basis. We really don't have an option for 7 or more. We usually will add them. Our system will not reject the group or the family. We'll just need to have a call with the group to have those members added. So we definitely will not turn that family away. We'll just need to make an exception on how we get them entered into the system. We will make this presentation available after the call. We will send out a recording as well within the next 24 hours, so you can come back and listen to that call as well. But it is 11:45, and I know we've gone through a lot of questions here. But if you have any additional questions, please do not hesitate to contact our support team. We are available 9 to 5 Mountain Standard Time. That email address is support@healthiestyou.com. Again, we appreciate your time, and we appreciate all your efforts and your support in Healthiest You, and we hope you have a great week. Thanks, everyone.